Ventricular shunts have been the most common form of treatment for hydrocephalus patients for decades. Shunts consist of two flexible tubes called catheters, connected by a valve that regulates the flow of cerebrospinal fluid. Despite decades of promising progress, shunts still fail at an alarmingly high rate. In this video, we will examine the history of shunt valves, reasons for their ongoing failures, and the direction of future research. In 1949, neurosurgeons Fred Nolson and Eugene Spitz at the Children's Hospital of Philadelphia implanted the first shunt valve into an 18-month-old infant with hydrocephalus. They used a ball and cone design to help control how fluid drained from the brain. This valve works a bit like a tiny door with a spring. Inside, there's a small ball that sits in a cone-shaped space. When the pressure of the brain fluid gets too high, it pushes the ball away from the cone opening so that the fluid can drain. Once the pressure goes back down, the spring pushes the ball back into place, closing the valve so too much fluid doesn't drain. Building the basics from the 1950s to the 1960s. In 1955, neurosurgeon Robert Pudens, working with engineer Ted Hare, was among the first to explore different valve types, helping to establish foundational shunt principles still used today. They designed slit valves, which use small openings in silicone to let fluid through. This design emphasized simplicity and reliability, influencing generations of shunt systems to come. A few years later, Hare introduced Pudens to Rudi Schulte, a German watchmaker. Together, they created the first diaphragm valve, which used a thin, flexible membrane to regulate CSF drainage. Their dynamic partnership and innovative ideas were instrumental in advancing the design and manufacturing of modern shunt systems. Around the same time, other valve designs also emerged. The miter and duckbill valve opened like a flap and was valued for its simplicity. The ball and cone valve, one of the earliest shunt designs from the 1940s, remained popular for its durability and reliability. Even though these valves saved lives, they had significant problems. Patients often experienced overdrainage, especially when standing, and once a valve was placed in a patient, the setting couldn't be changed without surgery. Innovation makes way from the 1970s to the 1990s. In the 1970s, doctors and engineers started to rethink how shunts could work. That's when adjustable shunts were introduced. These allowed doctors to change the pressure settings using a magnet without another surgery. This was the beginning of programmable valves. These valves helped reduce complications like overdrainage, but they were still imperfect. They relied on internal magnets to allow for the adjustment of pressure settings. An MRI could cause these settings to reset due to the high magnetic field, and additionally, doctors still couldn't see how well the valve was working once it was inside the body. Refining the design from the 2000s to the 2020s. In the early 2000s, the focus shifted to making valves more precise and reliable. New features started to appear. Antisiphon devices were added to help prevent overdrainage when patients stood up. Gravitational valves use tiny weighted balls to adjust drainage based on the body's position. Programmable valves became more advanced and easier to adjust.
There you go.
Flow-reducing devices helped regulate pressure spikes from coughing, sneezing, or sudden movement. These improvements made shunts more reliable and gave patients greater stability. Still, complications were made. As valves became smaller and more sophisticated, their tiny channels were more likely to obstruct. Some designs caused too much or too little fluid to drain, and in certain cases, the material themselves led to higher risk of infection or rejection by the body. The potential of smart shunts in the future, today and beyond. The future holds a lot of potential. Each new valve design builds on the last, bringing us closer to a safer and more effective shunt. Some of these valves are designed to adjust automatically, depending on one's body position or level of activity. Others may be able to send data to external monitors, giving doctors and families real-time updates about how well a shunt is working. The long-term goal is to develop smart shunts that can track CSF and intracranial pressure and automatically adjust fluid drainage in real time. This would make treatment more personalized to each patient's need and could significantly reduce the number of shunt revisions required. This technology has the potential to offer real peace of mind. Rather than waiting for symptoms or shunt failure, doctors could rely on real-time information about what's happening inside the brain to guide their decisions. Researchers and medical device developers are also exploring alternative ways to drain CSF, including approaches that redirect fluid through different pathways in the body. These emerging strategies aim to be minimally invasive and could help avoid the need for brain surgery. The problem isn't solved yet. Even with all this progress, the truth is, shunts still fail. They can clog, break, or give inaccurate data. Patients still go through multiple surgeries, sometimes dozens, sometimes over 100. And that's why we can't stop here. The future of shunts depends on continued research, better materials, and listening to the real experts, the people who live with hydrocephalus every day. The Hydrocephalus Association is committed to driving forward this progress by funding research focused on improving devices, building a collaborative engineering community, and inspiring the next generation of innovators to create solutions that could transform lives. Every design, every adjustment, and every idea has brought us one step closer to a better life with hydrocephalus. Shunts have come a long way, and if history has shown us anything, it's that there's even more progress to come.